Hi everyone, welcome to Nature's Way of Healing. My name is Dr. Carine Hall-Brown, and today we will be looking at asthma. And as you see, we're continuing in our series of looking at the respiratory system and the dis-ease that affects the respiratory system. Now, before I go into this presentation on asthma, I just want to make a disclaimer. The disclaimer is that you should never use the information that is given in this presentation instead of consulting with your general practitioner or your doctor. Now, we will be looking at what asthma is, the types of asthma, the symptoms that are associated with asthma, the causes of asthma, and the natural remedies that we can use to alleviate the symptoms of asthma. So that's in a nutshell what we'll be covering today. Now, what is asthma? Asthma is a chronic or long-term inflammatory condition that affects the respiratory system. And asthma occurs when the respiratory or the airways within the lung become blocked. And when it becomes blocked, this is what causes the blockage. It is blocked as a result of swelling, which causes narrowing, which results in the first place from an inflammation in the respiratory system. Now, this narrowing of the airway results in excess mucus, which further blocks the airway in the lungs. And once this blockage occurs, you will find that excess mucus is produced. And this results in difficulty breathing, and also we will get coughing, wheezing, and choking. So this generally is what asthma is. Asthma affects some people more than others, and it is not really known why you have some people are affected. It is a slight nuisance for some people, while it is a major life-threatening condition for others. So asthma varies in its effect on people, and there might be varying factors that cause this. But for the most part, the types of asthma might shed some light on what variables induce asthma. So we have asthma that is called allergic asthma. And as we did in one of our presentations in the past, we look at allergens and allergic reaction, and we talk about different allergens. And the different allergen cause allergic rhinitis, and allergic rhinitis will consistently cause inflammation in the respiratory passage, and this could cause blockage of the airway, which will induce an asthma attack. So we have allergic asthma, we have exercise-induced asthma, which is asthma which is induced, as it says, by exercise, and especially for people who exercise indoors. Indoor exercise, within the first 20 minutes, you'll find that the airway constrict because of the rapid breathing that occur. It causes constriction of the airway, and an asthma attack is induced. So that is exercise-induced asthma. You have occupational asthma, which occur, as it says, in most cases when we go to a workplace. And there are certain professions where people will be affected by this kind of asthma. For example, those who, hairdressers, beauticians generally, those that work, woodworkers, farmers, animal breeders, and so on and so forth. These professions, the woodworkers exposed to dust, the farmers, they're allergic to maybe the animal dander or just the fur from the different animals that they have to work with. and you will find the hairdressers who will is exposed to the chemicals, and these chemicals can induce an asthma attack, or it can cause an inflammation, which eventually leads to an asthma attack. And you also have nocturnal induced asthma, which can be very dangerous, especially for younger kids. For those people who are affected by this, it is not exactly known what causes this nocturnal asthma. It could be anything from a changes in temperature to the insects, or the insects that come out at night. So those are various types of asthma. And you also have the asthma that is cough variant asthma, and this asthma is induced by a respiratory infection. So once you have an infection in the respiratory system, this asthma irritates the airways and it causes swelling. And as we said, asthma is really a swelling, which narrows the airway. And once the airway is narrowed, you have mucus, which is a natural way which the body protects itself. And just like regular smokers, or just an individual where the cilia in your nasal passage is gone, you will find that mucus is what does the job. So you'll find people who lose the cilia in their nasal passage, those people will they will have a lot more mucus, because there is nothing to trap the dust that is coming in the air that we're breathing in. So we'll find that our bodies produce a lot more mucus, and the mucus is what traps the dust. So mucus is just a natural thing that the body produces that protects the body naturally. And in the process of protecting the body, it also have other reaction, such as blocking of the air passage. So those are the different types of asthma that we experience. We also, the different types of asthma. Now, what are the symptoms of asthma? And we kind of mentioned some of them prior. So the different symptoms that is exhibited when we have asthma include coughing, and this is a means of the body trying to grasp air, wheezing when you inhale or exhale, or whistling. As some people, you'll hear the strong whistling sound coming out of them. You wonder what it is. It is just the body trying to get some air. So it is the alveoli at the end of the bronchiole, which is actually collapse. It really collapses, and because there's no air coming in, and it creates a whistling sound because of the small passage through which air is passing through. So it's whistling, coughing, tightness of chest, and pain in the chest as well. These are all different symptoms that we experience once we are having an asthma attack. And what are some of the causes of asthma? Well, asthma, as we cannot separate asthma from an allergic reaction, because somehow, and there are many other things that you cannot separate asthma from. And if you do the research, you'll find that a lot of the times you'll find asthma under allergen or allergic reaction. For some reason, that's because there is no actual reason why some people have asthma and some don't. But if you have an allergen that you react to, and you're constantly exposed to this allergen, then it's going to cause irritation. And the irritation, which is an inflammation in the air passage, will result in the narrowing of the air passage, and that narrowing will induce asthma. And airborne, so causes of asthma, we have airborne causes, as we look at when we did allergen. We have pollens, the pollen which we are exposed to and we literally have no control over. Pollens is one of them, animal dander, dust, mites, and also pollution. Pollution is also airborne, something that is in the air. Now, we have medications, so different types of medication, as we mentioned in one of our previous presentation, we talk about penicillin, which is from a mold, and this can trigger an asthma attack if you have an allergic reaction to that. And there are people who will just react to things like aspirin or just different medication. So different types of medication can also trigger an asthma attack. Now, chemicals, household chemicals, constant exposure to chemicals that is used within the house. Now, nail polish, these are all things. Constant draining of the sinuses is also another reason why we can get an asthma attack. Okay, so these are some of the possible reasons why we can have asthma attack, and we mentioned exercise. Exercise could also cause it as well. A lack of oxygen in an environment that we live. So all of these can induce an asthma attack, and it is the same for grown-ups as well as older people as well as children. It is basically the same causes or the reasons that cause an asthma attack. And even food that we eat, exposure to them, constant exposure, constant consuming of some food, irritating the sinus, causes the sinus to drain. And once the sinus is draining constantly, it is going right in the back of the throat, and it ends up in the lungs somehow, and it results in a induced asthma attack. So those are some of the reasons that causes asthma. Now we're going to move on, and we will be looking at some of the things that you can do to alleviate the symptoms of asthma. Or what we could do as well is to prevent having an asthma attack. Okay, so we know that asthma is an inflammation. It is an inflammation in the lung or in the airways of the lung, and this inflammation can be fixed with quite a few things. So we're going to look at it, and when we look at any kind of disease or any disease that we will look at, or any kind of problems that we have with our respiratory system, we must bear in mind the 8 laws of health. The 8 laws of health is the key. And once we follow this guideline, which is the blueprint which the Lord gave us, if we follow these guidelines, we will 100% have a reduction in the symptoms that we experience on a daily basis. So some of the things that we will look at is nutrition. And for the most part, we are talking about our diet, and as I have said before, a 100% plant-based diet. There are certain foods that really trigger a sinus inflammation and also asthma attack, because the inflammation of the respiratory system comes before we have an asthma attack. So the diet is very critical. Any form of dairy products. Any form of dairy product will 100% trigger the sinuses, and once we trigger the sinuses, we are going to have that inflammation in the airway. And once the airway is inflamed, you will find that the passage is going to be blocked, and you will have an asthma attack because we don't have enough air going in. So our diet must be 100% plant-based, and even when it's 100% plant-based, we must do a study, keep a diary of what triggers you, because different people are triggered by different things. There are some people who have asthma who could eat nuts, and there are some who could not eat nuts. So you must keep a diary of what triggers you in particular, so that you will know what to stay away from when it comes to diet. Okay, so Diet is one thing. Exercise is very important because it has a way of strengthening. And I know that I mentioned that asthma can be induced by exercise, but not everyone will respond to exercise in the same way. The bottom line is exercise will strengthen the lung, and if you consistently exercise, especially when you are exercising in an environment where you have fresh, clean air, because that is the key, and it is critical that the air is clean, especially when you're working out on the inside. So working out on the inside, you must have fresh, clean air in order to work out, because once you start, within the first 5 to 20 minutes, you're going to notice the airway narrows if there's anything, any form of allergens that is going down in your respiratory tract. So exercise is good for strengthening the respiratory tract, strengthening the alveoli, and just having air going back and forth, and drinking a lot of water. Water also keeps the cells turgid. And once the cells are turgid, meaning they are in full size, you will find that they flow easier into the blood vessels and they move around much faster. So if you're unlike if you don't drink enough water, you will have tons of cells backed up at the end of the blood vessel trying to get in, and that also can cause you to become deprived of oxygen, because then it would not have a fair exchange right there at the alveoli in the capillaries. So drinking enough water is key. Now, drinking water, exercising, fresh air, we talk about those. We must get enough sleep, which is rest. And as I said, rest is what causes the repair of the body. If we're not resting, we're not healing. So once you don't rest, you're going to be irritated. Your body is you're going to be aggravated generally, because you will find that aggravation will come natural. Like when you're hungry, some people, when they're hungry, they don't eat. You are just seriously aggravated. And when someone say to you, you never heard they saying a hungry man is an angry man. So it's kind of very similar when you don't get enough sleep. So not sleeping, it's not because you don't get the sleep, but it's because your body is not rested. So every nerve in your body become aggravated. And once the nerves are aggravated, then you will find that it's easier, because it's stress on the body, for you to get an asthma attack. So getting enough rest is critical. And trusting in God is like first and foremost. We must learn to trust in God, that all the remedies that He gave us is going to help us to feel better. Our diet, the exercise, the water, the temperance that we must exhibit, even though some of the food that He gives us, or all the food that the Lord gives us to eat, those food are very good for us. We should not overdo any of it. We should not drink too much water. We should not eat too much of any one thing that is good for us. So it doesn't matter. We should just exercise temperance in all things, because temperance can trigger aggravation. So not having temperance can trigger us to be aggravated. Now, when we look at the 8 laws of health, and I must stop there where that is concerned, we're going to look at some of the things that I have here on this table. And I have on the table onions, and good old onion is really one of the foods that we get that is an all-rounder. And we're talking about the respiratory system. And in the past, we've used onion in other mixtures for allergies, and it's not different for using the same onions, because onions and pineapple juice, have a special chemical component called quercetin. And quercetin is very, very good for any kind of inflammation that is within the respiratory system in particular. The pineapple juice also have bromelain, which is an anti-inflammatory component. And I have here cumin, which is an all-rounder anti-inflammatory, and it is no different for the respiratory system. So if we take cumin and we take some onions and we combine that with some ginger, we are going to have ginger is a calmative, turmeric is a calmative, so it is anti-inflammatory, and onions also have that component which will clear the nasal passage, and also it has the component which is anti-inflammatory. And if we combine all of these ingredients together in the blender, we are going to end up with a all-time calmative, which is going to calm the respiratory tract down, and also the onions will help with opening the passage for air to flow. Okay, and we also have what we call licorice, and licorice is a herb from a plant, and this herb is sweet, and it is a very, very good herb for the respiratory tract. Okay, so it's a good anti-inflammatory as well. So we have all anti-inflammatory. Ginger is a stimulant on one hand, but it's also a calmative. So it has two sides to it. It has a buffer in between, and it stimulates and then it calms down. So for those who know about having stomach ache and people having irritation in their digestive system, you'll take ginger. And the reason why ginger works is because it is a calmative. So we take the ginger to calm the respiratory system down. We also have vitamin D. And believe it or not, vitamin D has an anti-inflammatory property and antimicrobial property in it. So vitamin D is also very, very, very important. Okay, and vitamin C. This vitamin C is vitamin C with rosehip, and this is 1,500 milligram. And you could take a high dose of vitamin C, as high as your bowels can take it, which means that as much as your bowels can take without you getting a diarrhea, you could take vitamin C, because it is extremely good. It helps in flushing the system. Now, if all of these are combined, so we have some onions. So we're going to put our pineapple juice, and we are blending, and I'm using half a cup of pineapple juice, a quarter of onions. So that's a piece of onion, a small onion, and then we're going to put some of our turmeric. So we want a teaspoon of turmeric in here. And remember, turmeric is the best anti-inflammatory, not just for the respiratory system, but also for any kind of inflammation that you have. Any kind of inflammation that you have, turmeric is extremely good for it. Now, one thing that I do know that most of us take small doses of turmeric. You will not overdose on turmeric, and that's a teaspoon of ginger. You will not overdose on turmeric. And then I'm going to put some licorice in here. I'll put 1 teaspoon of licorice in here. And this licorice is very sweet, so we put it in and we are going to blend them all together. So we have our ginger, we have our turmeric, our pineapple juice, and our licorice with our onion. And we're going to blend these, and we are going to have one real nice anti-inflammatory. And we focus on the inflammation, especially for asthma. So it's blending it out real nice. And this is the top of the line Vitamix blenders. So it's all blended. And this blender is like one of the super, you know. And then we can take 4 ounces of this mixture at least twice a day. And this is one combination that we can take to prevent this inflammation. And as I have done in the past, I'm going to drink some of this super anti-inflammatory. I am kind of hoarse, so this will do me exceptionally good. And as I said, our turmeric is extremely good for any inflammation. The ginger is good for inflammation as well. And our onion is also good for the inflammation. So we have, and licorice, especially for the respiratory system. So, you know, this combination is a super combination for someone who has chronic asthma attack, which is continuous. Then you would want to try to take this more often than 2 times a day. You will take it at least 3 times a day to alleviate the symptoms as they, you know, before they actually come up. So I'm going to drink this. I'm going to taste it. I'll tell you how it tastes. It tastes pretty good too. It's really good. So if you make it at home, if you make this mixture at home, just tell me how it tastes. The recipe would be posted on below this presentation, so you will see the ingredients and you could try to make it and just give me your feedback. Let's hear how it worked for you. Okay. And I have a question for you with regards to this segment. Now, how does ginger work in terms of its effect? I did give some information about how ginger works. Now, how does it work? You could answer this question at the bottom. And one more question. What is the chemical component that is present in pineapple that cause it to be an anti-inflammatory food? So that's the next question, and I'm looking to see your answers for these questions. Now we're going to move on to the aromatherapy, and this is one of the recipe that we have for asthma. The others will be posted or attached to this clip. Now, you just heard this kettle that was steaming up. It was warming up this water so that we could do this nasal hydrotherapy. And today we can either use lavender, because lavender is an anti-inflammatory as well. It has chemical component which is an anti-inflammatory, or you can use eucalyptus oil. Now, I'm going to use eucalyptus oil. Lavender is good, and I'm sure you could remember from the first or one of our previous video clip where we did nasal hydrotherapy. At that time, I think I used peppermint oil. Right now, I will be using lavender oil, and all it requires is a bowl like this one, or you could use a smaller bowl. All you need is to be able to stick your head over it at least 8 inches away from the liquid, and all you need that comes up is the steam, which will clear the nasal passage, it will clear your sinuses, and it will also enter your respiratory tract and clear any kind of inflammation which is in the respiratory tract, or assist in the clearing. Now, this is a temporary relief of the symptoms that you experience as a result of nasal congestion or asthma. So it's really the temporary, and what you would need is your bowl, and you will need a towel. I like this nice pink blue towel. I just feel blue today, so I chose this blue towel. And you need enough water to line the bottom. So let's say maybe about 10 ounces of water. You don't need a whole lot of water. And I am going to use my eucalyptus oil, so I will put 5 to 6 drops of eucalyptus oil in this container. Okay, those are my drops. And I am going to put this over my head. So this how I will do it. So we could start like this so it doesn't get in the way. Then I'm going to go down, and remember, we must be careful because steam is hotter than water. So we are going to be careful. If you're doing this with a young child, you must monitor the young child, take all the precaution that is necessary so that we don't have any serious harm done by the steam or the water. So we're going to go down, and remember, it's about 8 inches away from the liquid, and you must be covered. And then you're going to inhale and exhale. And you could do this for at least 5 minutes, because this is really going to get deep into your lungs. And if you feel like the bowl has settled too much and the steam is not coming up, you could move the bowl a little bit so that the steam will rise. And you could do that for 5 minutes. It's going to really clear your passage. You could hear me. It sounds different, right? So it actually does clear the nasal passage. So you could try this. This is very simple. And if you don't have eucalyptus or lavender, the steam by itself, once it enters the airway, it will also alleviate it. If you have the oils, it will work a little better for clearing the passage. So this is, you could do either or. There is also another way that you could do this. You could just use a towel, and you could put the oil on the towel itself. before you go to bed, and keep it near to you. Some people put it on their clothes. They put it onto their clothes so that it helps in the clearing. They smell the oil, and the oil helps to clear the passage once you have an issue with the airway and its blockage. So those are different ways that you could use the two oils, which is very good for asthma and clearing the airway in general. So the questions that I have for you with regards to this section: at what distance should we stay away from the water, or the water itself? What is the distance that we need to stay away from the water? That's your question. Can you answer that question in the section below this video clip, so that I actually know that you're listening and you know how to take precaution? And if there are any other types of clip or video that you guys would like to see, you could also mention what your preferences are, so that we could work on those video. So for this segment, that's it for asthma. If you have any question, you could also ask your question. Send your questions to write your question, and we will respond to them accordingly. Thank you very much for watching. And as I said, it's a pleasure.